Good afternoon. My name is Lisa Coleman. I'm the Executive Director for CalCOA, the California Long-Term Care Ombudsman Association. And I want to start off by simply saying thank you. This committee has been very good to the Ombudsman program and has been supportive. Last year with the Senate and on the Assembly side, we left the joint conference with a ask for $6.4 million. Unfortunately, that $6.4 million was not the right number, and we walked out with 1.4 as being the right number, with $1 million one time only. So I'm back because I was not exaggerating last year when I said we need $5 million to hit minimum standards of a quarterly unannounced visit. So we're back for $3.6 million. I don't feel the need to spend time talking about the merits of this program because I believe you believe in it. But I would like to spend my time talking about where we can find that $3.6 million augmentation. CalCOA leadership has had the opportunity to meet with the governor's administration, and the direction we've received by and large is look to special funds and to consumer funds. Consumer funds, last year, the Skilled Nursing Association did a bed fee of $3.35, which amounted to $400,000 of our $1.4 million. If we were to look to a similar augmentation on the assisted living side, a multi-billion-dollar industry in California, if we did a $5 bed fee, we'd be looking at about a $900,000 augmentation. Now that's not the $3.6 million we need, but it moves the needle in the right direction. In addition to consumer funds, special funds, the Long-Term Care Ombudsman Program receives funding augmentation from two funds currently, the Skilled Nursing Citation Account and the Skilled Nursing Quality and Accountability Fund. The Skilled Nursing Citation Account is just like it sounds. Skilled nursing facilities are cited. We collect the Department of Public Health collects the funds. It goes into an account. It was determined that the Ombudsman program was an appropriate source for this funding after we lost our general funds. And they, last year, with the recommendation of this committee, they did an additional $1 million one-time augmentation. Now, I am never going to stand in front of this office and say that the Ombudsman program won't take money in any way you want to give it to us. But I will point out that one-time only money has a diminishing return. Because at the end of the day, what the 35 programs need is staff. We're still operating with 50 fewer employees than we had in 2007. Now, the good news is I don't think we need to look to that citation account as a one-time only augmentation. This committee and the Assembly on the counterpart have heard from the Department of Public Health and their efforts to streamline their citation process, that they are on track to reach the legislation's goal of a 90-day complaint cycle. So what that means is that more complaints will be investigated on a timely fashion, more citations levied, funds collected, creating a more robust funding source for the Long-Term Care Ombudsman. Our second source of funding is the Skilled Nursing Quality and Accountability Fund. This is a multi-billion-dollar fund in which skilled nursing facilities collect money amongst themselves. It is matched on the federal level, and then it's redistributed back to the skilled nursing facilities as an award for reaching certain levels of quality and accountability. In 2011, when the Ombudsman, after the Ombudsman program had lost the general fund, in 2011, it was determined that this fund was an appropriate source for augmentation because the work of the Long-Term Care Ombudsman improves the quality of care and quality of life for residents in skilled nursing. The legislature wrote that that $1.9 million was to be an increasing appropriation out of this fund to support the activities of the Ombudsman program. So the good news is this fund has continued to grow over the last few years. The less good news is that the Ombudsman program has not experienced the intent of the legislature to experience that augmentation.
Why is that fund growing?
Well, last year that fund was due to sunset, but the legislature and the governor both agreed it was a good fund and they extended it, and they added an additional augmentation of $3 million in general funds last year with the $3 million each year for the next 4 years. So that's an additional over $300 million. The facilities themselves also have been contributing to that augmentation. The federal government then matches it, and so it grows in that way. So when we look at it's a growing source of revenue, it was the legislature's intent that the Ombudsman program receive a greater augmentation from this funding source, I think it's a good bet this would be a good source. And then there's always general funds, because at the end of the day, the services the services that the long-term care ombudsman provide for the California citizens is a good use of general funds. Calcoa leadership, we want to thank the committee and the staff. We've had really good conversations, and we look to you to help us maneuver within the departments as to where we might find additional special funds or how we might pursue consumer support. With that, open to questions.
Thank you very much, appreciate it. Moving on to the Senior Nutrition Program presented by the California Commission on Aging.
Actually, we're going to start with the Area Agency on Aging Association. Briefly, thank you.
So we're doing this in partnership not only with the Commission on Aging, but also with the California Congress of Seniors. And first, before I talk about the nutrition, I just want to say that we certainly support the two previous requests you've heard. Ombudsman funds flow through our organizations, and we're a staunch supporter of additional funding for them. Also, MSSP, obviously case management and keeping seniors out of nursing homes is very consistent with our goals, so strong support for both of those proposals. Regarding nutrition, a couple things that I want to say about that. A year ago, we brought forth to this committee a pretty broad-based funding proposal, which covered a lot of different services. And one of the things that we talked about this year as an association was, do we want to provide that broad-based proposal again because we recognize there's a need in all these different areas, or should we focus in on one topic? And after extensive discussion, we decided that nutrition would be our primary focus this year. And it's a great pleasure to be here to talk about that because it's such a simple program to explain. You provide food to hungry, at-risk seniors. And I think there doesn't need to be any convincing that that's an effective service. It's an effective way to keep seniors healthy and independent. The focus of this proposal is really on home-delivered meals or Meals on Wheels, which I think is even easier to understand. So without having to go into all the feel-good, this is the socially correct thing to do, I do want to share just some facts of the impact of these services. We talked about EESI earlier, and that 36% of California's seniors are at risk for being unable to buy their next meal. And this example of funding, I think, is one key that helps with that. But I want to talk a little bit about what happens to at-risk seniors. They're almost 2.5 times more likely to have health problems. They're 60% more likely to experience depression. They're 53% more likely to have a heart attack. They're 52% more likely to develop asthma. They're 40% more likely to have congestive heart failure. So investing in healthy nutrition for that population not only makes sense socially and is the right thing to do, but it decreases the long-term costs that we see in healthcare systems for this population. The department's report talks about a federal augmentation to nutrition that's coming in. Forget the exact amount, $2 to $3 million a year, and that's really significant. However, if we just look at the cost of inflation on that program, we would lose 332,000 home-delivered meals this year. The federal augmentation almost gets us even on that. Gets us around 300,000. So part of what we're hoping for with this augmentation is to make up about 10% of that loss of meals from home delivered. But the bulk of it is really to try to address additional individuals that are currently on waiting lists or can't get this service, and looking at the added benefits of avoiding emergency room use, or people ending up in long-term care facilities and skilled nursing and the costs associated with that, or people in the hospital for other reasons outside of the ER.
So it's not that we're going to feed seniors who don't qualify for the federal program. It's those who are entitled but just aren't being serviced because
there's not adequate
waiting list, there's
capacity
not-
to
got
meet
it.
the need that's out there.
We're going to augment.
Right.
Okay.
Exactly. And calculating that, we're trying to look at what could be saved, and there's a variety of studies. San Diego has done a pilot project about what happens if a senior leaving a hospital gets home-delivered meals. They found that there's a huge decrease in the rehospitalization rate of that population. There's also the other factors that I cited in here about less likely to have a heart attack, et cetera, and we see resultant studies from Brown University and other sources which can calculate the cost savings of those events. We took that a little farther in our analysis and looked at not just the cost savings of those individuals, but what's really the cost saving to California. And we calculated that a few ways. We took the success rate of the studies and then lowered that a little bit, because we don't know if a pilot is ultimately more successful than an ongoing program, because they may be doing special projects to target the most at risk. So we lowered those success rates a little bit. We also looked at what the cost saving was in general for those hospitalizations or nursing home expenses. And from that, we calculated how many of those people are actually Medi-Cal recipients. So that cut the savings in half again. And then we calculated how much the state pays to Medi-Cal versus how much the feds are paying for Medicaid, and cut the costs proportionally again. The result of all of that was that the $5.4 million augmentation will still save the state, not the entire system, but the state specifically, between $55 and $85 million a year, and that's taken a very conservative approach. So we think this proposal is not only the right thing to do to help seniors, but it's also the financially appropriate thing to do, that the savings on the state will be practically immediate and very significant. With that saying, unless you have questions, I'll turn it over to the commission.
Just briefly, we wanted to add the social impacts of these programs. You know that the Elderly Nutrition Program really is a cornerstone of the Federal Older Americans Act programs. And one of the important things that is required of those programs is that there be a social benefit. Primarily, the idea was from people coming into a congregate meal site, so they would have socialization.
Right.
They would have health education and nutrition education resources provided to them, and have contact with people who are providers of other services, so if there's a need identified, they could be connected. The Meals on Wheels program does this even better. For the people who receive Meals on Wheels, these are homebound people. These are people who don't have the ability to get out and go to a congregate site. Quite often, the person who delivers their meal is the only person they're going to see that day and maybe that week. There are incredible opportunities that these volunteers take quite readily to get to know this senior, to pay attention to what's happening in that home. Is this person appearing to be less healthy? Is the condition of the home in worse shape? Is there a sign of exploitation or abuse? There are programs in the state that have actually implemented mental health assessments done by their Meals on Wheels delivery people. This is an essential component of keeping people in their homes and keeping them safe. And the chance to augment this even slightly and bring more people into the system right now is really important, especially as we know the numbers are increasing. So we ask for your strong support for this. Thank you.
Thank you very much. To speak on this one? To speak on the, oh, okay. Yes, sir.
Thank you, Chairman Mitchell. Let me start by first also echoing, I've participated in the congregate meal program as well as Meals on Wheels at the senior center level. I've seen it working firsthand, and again, my full support. I can't believe he wouldn't be supporting those two programs. excuse my voice, but I think I'm losing it as a result of the allergies here
Understandable.
in Sacramento. I'm going to have to escape back to Orange County here, I think. Again, thank you, Chairman Mitchell and committee members, for the opportunity to speak before you today. My name is John Pointer, Chair of the Joint Rules Committee of the California Senior Legislature. I'm here today requesting your approval of our request for temporary funding of the California Senior Legislature for budget year 2016-2017. Let me provide some background. In 2014, the California Senior Fund, Code 402, fell below the $250,000 minimum contribution level by $20,000. However, SB 997 returned CSL to the Form 540 using the new name California Senior Legislature Fund and Code 427. While intended to make a seamless association between the CSL organization and its voluntary contribution fund, this well-intentioned choice of fund names backfired on us. We discovered that the public is reluctant to donate to an organization associated with the state legislature
Yep.
and made up of retired state legislators, as potential donors erroneously assume the composition of CSL to be.
We could have told you that.
I think some of you did. This choice of fund names has resulted in revenue from the voluntary contribution program declining by over 74%. In 2015, and we are on course for a similar outcome in 2016, in spite of our robust promotional campaign around Code 427. We have attempted to correct our fund name through AB 2497, which proposes to change the name of the Code 427 California Senior Legislature Fund to California Senior Citizen Advocacy Fund. AB 2497 has passed unanimously both the Revenue and Taxation and Aging and Long-Term Care Committees during the month of April. However, your help is needed through the passage of this temporary funding proposal to continue CSL operations while we resurrect our revenue stream via the proposed name change outlined above. What's so special about CSL? The CSL is a product of the legislature. It was founded primarily through the efforts of State Senator Henry Mello and is established in state statute, Welfare and Institution Code sections 9300 through 9305, and as well as Tax and Revenue sections 18275 through 18279. In addition, CSL has a 35-year history of legislation in support of seniors in the state. 35 years. We just celebrated our 35th anniversary. Over 200 proposals drafted by this organization have been signed into law. And I understand I stand corrected, that's 210 specifically. No other organization in the state has such a storied past in support of seniors. I referenced our services to seniors over the past 35 years. However, the future presents some very challenging times for both seniors and the organizations that serve them. The future growth in the population of seniors in the state has been described as equivalent to a tsunami and will be straining the resources of the state. The senior population will double by the year 2030. Financial and physical abuse has already been documented by others here. Against seniors will continue to grow at an alarming rate. 1 out of 10 seniors over the age of 60 are a victim of elder abuse. A recent article in the Orange County Register noted that the 17% of seniors over the age of 65 have been taken advantage of financially. On a personal note, and it's already been stated by another individual, I have received at least one call a week informing me I owe the IRS and I'm going to jail if I don't pay my outstanding balance immediately. Now, I take these with a grain of salt since I worked for the IRS for 36 years. We wouldn't make those kinds of calls.
They called the wrong?
They called the wrong person, but it's a robocall, so they won't pick it up. Abuse is only one aspect of the problems facing seniors. Long-term care, nutrition, as has already been documented, transportation, all increasing concerns. In the area of long-term care, over 70% of seniors over the age of 65 will need long-term care, and it represents the largest unfunded liability in the state. Finally, medications are also an issue. Counterfeit medications purchased over the internet are on the rise. Labeling can be confusing to seniors, as can adherence to the prescribed dosage. So with the above challenges in mind, who fills a legislative void if there's no CSL? No other organization advocating for seniors performs the legislative role that CSL performs. Knowing what the future holds for seniors in the state, can we afford not to have a CSL advocating for seniors? And working with the legislature, as you all know we do, closely to find legislative solutions to the challenges facing seniors. So in conclusion, I urge you to support this temporary funding proposal. In doing so, you enable this great organization with over 35 years of service to seniors to continue its mission of advocating for seniors and working closely with the legislature to tackle very challenging future seniors and state of California issues we face. Thank you for your support.
Quick question. I see in the write-up that the 16-17 budget assumes that the fund will yield $320,000 to fund the 1.2 positions. The request is $500. Prior to the transition of the funding to the tax checkoff, what was the general fund contribution to fund the senior legislature?
We were funded entirely by the checkoff program.
Oh, always have been.
So one other correction, the 320,000 would be corrected to probably the same amount that was collected in 2016, around 60,000.
Got it. So the drop-off, so you were always funded through the tax checkoff, but the change in name,
Yes.
we think is one of the contributing factors to the decrease.
We've analyzed that. It has to be the most significant contributor in our estimation.
So this would be the first time that the senior legislature is funded through the general fund?
Correct.
Got it. Any questions? Senator Monning.
Thank you, Madam Chair. I'm mindful of the patience of those waiting to comment, but first on the senior legislature, I think you're probably right in terms of that analysis, but I think another factor is each year the legislature adds more choices.
More competition.
And you have more competition in terms of voluntary checkoffs, and with people doing more e-filing where they don't necessarily have the form with those choices, the boxes aren't getting clicked by a CPA. So with all of these, we need to do better public education, but appreciate your being.
Couldn't agree with you more. We were at number 3 one time. We slipped to 17. We will be at probably 21. Now, you might be able to advertise, look for me at the bottom of the form,
Right.
But still, your position, I believe, dictates the contribution you're going to likely receive.
Yeah, and people even seeing it when they're e-filing, but thank you. And then if I could, just a quick question on the long-term care ombudsman program. You offered some, I think, Ms. Coleman, some thoughtful direction for us, but just so I understand it, the investment proposal would be $3.6 million total. Do you have some breakdown of, you mentioned several funds, of where we might find that based on the background you provided us?
If I had to take the 3.6 million and divide it the easiest way, I would look to an additional, I would continue the one-time only 1 million that we received this year from the skilled nursing citation account. So that'd be my one. I would look to 2,100,000 out of the skilled nursing quality and accountability fund. And then I would look to 500,000 in general fund.
Great, and I think you did cover that in your comments, but it's helpful to just kind of have that very direct breakdown. Thank you very much.
What about the $5 per bed fee you referenced?
I do
the
believe,
assisted living facility?
I do believe it is appropriate that we do look to that. It's going to be a bigger fight.
Sure.
And so if you're asking me the easiest way to get to 3.6 million,
Got it.
but when we're looking at the work that the ombudsman does, I think we do need to start looking at the consumer side. We have had a 50% increase in the number of calls and complaints and inquiries from owner-operators, facilities, and staff in the last 5 years. So they're using our services.
Got it.
Thank you. Thank you, Madam Chair.
Thank you very much. And for our, thank you, Mr. Pointer. For our final proposal for investment, it's the $4 million general fund augmentation for the Alzheimer's Daycare Resource Centers. And we don't have an advocate, so we will follow up with whoever brought it to Budget Committee to bring it to our attention. With that, we'll open it up for public comment. Remember, you're commenting on the entire Department of Aging section, issues 1 through 5, including the public investment.
Which must certainly mean we have more than 1 minute.
Well, in that we got started at 11 and it's
You can put a
5:20.
stopwatch on me. I'll be very,
1 minute, but I won't cut your mic if you go a little over.
okay. First, we support the budget change proposals out of the department. We particularly pleased to see some funding for oversight of the CBAS program. We look forward to the day when we can also support funding for the CBAS centers, not just the oversight of them. Over 20% of that capacity has been eliminated in California in recent years. We strongly support the MSSP program. It was and is an excellent program to serve the most vulnerable people in the system, if you will, the most acute cases. And we really would like to see the transfer of that service completely into Medi-Cal managed care. We believe that that timeline needs to be extended until the managed care plans get it right, frankly. The next thing is we strongly support I'm trying to make sure I've got the right order here. Well, we support the nutrition program. As Clay said, we've been involved in developing this specific program. It is the quickest way that we know of to deal with the issue of senior poverty and the growing rate of senior poverty in California. Our first love has been and continues to be the ombudsman. It deals with the most vulnerable people in the state, folks who are in institutions, very little likelihood to get out, and many of them have no family to help oversee their needs. So, that I guess is a minimal investment when you look at the entire state budget for, as Clay said, a population that'll grow by 100% in about 12, 15 years. Thanks.
Thank you. So you did that in under 2.